Head tilt, chin lift. This is the method of choice for opening the airway. Do not use this method if you suspect head, neck, or spinal injury. Position the patient lying face up. Kneel by the patient's shoulder towards the head. Place one hand on the forehead and place the fingertips of your other hand under the bony part of the patient's jaw. Lift up on the chin, supporting the jaw, and at the same time, tilt the head back as far as possible. For infants and children, place in the sniffing position. Do not overextend. Always keep the patient's mouth slightly open. Use your thumb to hold down the patient's lower lip. Once the airway is open, check breathing. Look, listen, and feel. If patient is not breathing, start artificial ventilations. If unable to ventilate, assume the airway is obstructed. Jaw thrust. The jaw thrust is maneuver recommended on an unconscious patient with suspected head, neck, or spinal injury. Position the patient lying face up. Kneel above the patient's head. Place your elbows next to the patient's head on the surface where the patient is lying. Place both hands on either side of the patient's head. Grasp the angle of the patient's jaw on both sides. For an infant or child, use 2 to 3 fingers. Use a lifting motion to move the jaw forward, up with both hands. Keep the patient's mouth slightly open by using your thumbs if needed.